There is quite a lot of anticipation. We've been working with PAHO over the years, and I often say to my associates in Grenada that PAHO is a household name in Grenada as well as a lifeblood for our health sector. And over the years, we've been looking at a number of issues. As you know, the Caribbean region has led the charge on chronic non-communicable diseases. So it's a critical area for us as we do our own revisiting of the delivery of health services in our own island. The whole issue of the management and treatment of HIV and AIDS and other sexually transmitted infections, specifically focusing on the issue of reducing the incidence of mother-to-child transmission. There is also interest for us in terms of vector control, although I did not see it on the agenda for this meeting, but last meeting we'd raised it because unlike other territories where there may be challenges of malaria and other communicable diseases of that nature, we in the Caribbean have a particular challenge with dengue because of the kind of mosquitoes that we have in our region. In addition to that, we are also looking at the whole issue of information technology as we develop our own systems. So I anticipate quite a lot of discussions. We've started some already at the level of the CARICOM caucus, and we look forward to taking that into the conference as we move forward on Monday. So it's quite a lot to expect. Well, I don't think, unlike any of the other Caribbean islands, we are seeing increasing morbidity as a result in changes in the lifestyles of our people in terms of what they eat, the lifestyles they lead in terms of health and exercises and so on. And we've also found as governments that we spend significant sums of monies to treat complications of chronic non-communicable diseases. So our government has taken a decision to revisit the way we deliver health services and focus specifically on primary intervention. Quite a lot of work has been happening in Grenada in terms of establishing our chronic non-communicable disease commissions. We have been looking at strengthening our community-based services, a lot of public education, a lot of engagement of non-health stakeholders, and recently trying to bring on board all other sectors of government, because we feel very strongly that a healthy nation is basically a plus or a bonus for economic development. And I think our own Prime Minister has bought into that. So we've had a really good sell in the health sector that now my other cabinet colleagues are recognizing that health is critically important because you need a healthy nation for economic development to occur. So we have been involved in a lot of new initiatives, revisiting our own administrative structure in terms of how we deliver the service, and also trying to grapple with how best we can position ourselves to benefit from preventive activity at all sectors of the society as a means of reducing significant costs and also reducing the morbidity as it relates to complications of chronic non-communicable diseases. There is a very successful program of movement because we try to get our people in country to exercise more. And our military forces have joined with us on that and are very active. As a matter of fact, we have them involved in all of the parishes. You see, in small countries like ours, we have parishes, or countries divided into 7 parishes. So we have the military who are involving a wide cross-section of public sector employees as well as private sector employees. And it's interesting to see them every afternoon going down to the rigorous exercise, and people have grown accustomed to that. In addition to that, quite a number of the private sector companies have engaged in workplace wellness and are actually doing annual screenings and so on. And a couple of years ago, the Ministry of Health implemented a program called Move It to Lose It, which was competitive, and there was a Prime Minister's trophy that went with it. So the private sector got on board and got very serious, brought in their trainers and so on. So it has created that kind of momentum. In addition to that, looking at the whole issue of children and how best to deal with children, we have started in conjunction with New York University a program on dental health, because we feel that, you know, the way to a man's or a woman's heart is through the mouth. And we felt very strongly that if we started a program of good health care as it relates to taking care of your teeth, you will avoid a lot of complications later on, as you know, that can happen from somebody not having healthy teeth. That program is going very well, so that's another major success in the schools. Another thing we've done is we recognize it's a little difficult sometimes to get men to buy into health issues. So our staff has implemented something called the Men's Health Outreach Program, where they're actually reaching men where they prefer to be, on the basketball courts, on the football fields, in the communities, in the fishing communities. and it has taken off and been having tremendous success. So it's something we want to expand. In addition to that, we also have the NGOs. What we've done is establish a chronic non-communicable disease commission. But our commission comprises mainly people in the private sector, the church organizations, and other NGOs and civil society organizations. So persons within the health sector sit on the commission, but as ex officio members. So they are what I would call the outreach sources for their constituents to buy into the new changes in diet and lifestyles and healthcare promotion. So it is working very well for us at this point. Fortunately for us, if I can start from that background, our maternal and child health program, so I'm going back to the beginning, is built around the main focus of our nursing fraternity taking responsibility for that area of work. And in the past, for an individual in the nursing profession to qualify for movement up the scale, you had to become a midwife. So at this point, almost 80 to 90% of our nurses who are trained and qualified are all midwives. And they are the ones who are placed at the community level. And they basically manage and monitor the maternal and child health program. So it involves screening for pregnant women, it involves well baby clinics, it involves monitoring the kids from 0 to 5, looking at their immunization, and it feeds into the Ministry of Education in that the teachers are now on board with that program, and also the Grenada Food and Nutrition Council, which is a statutory body that is aligned with the Ministry of Agriculture. So these three ministries play a pivotal role. Now, in relationship to maternal health itself, you would find that our obstetrician gynecologists are brought into the picture during a particular period in the life cycle of the pregnant woman, of the pregnancy. And therefore, most of the monitoring is done by nurses. And you would find our obstetrician gynecologists coming into the picture when there are complications or there are reasons for referral. That has proven to be very successful. So what has happened out of that is that we now have every mother in our country submitting to HIV without any legislation. It is just a matter of the promotion, the protocols that have been established, and there is compliance. We are also at a plus in that all of our obstetrician gynecologists have both private practice as well as public sector practice. So there is little room for us to lose anyone because they're all integrated into the system. So through the combination of the Ministry for Education, the Ministry for Health, the Ministry for Agriculture, and to a lesser extent the Ministry for Social Development, there is a cohesive network that enables us to pick up kids, at various levels, so that we make sure that no child is left out. So whether it is a social issue, an educational issue, a health issue, which involves nutrition and so on, that is happening. However, there is always room for strengthening that. And at the moment, we are now working more feverishly with the Ministry of Education to look at school diets. Some schools already have restrictions on what can be in the cafeteria. And in some instances, the schools will even, what I would call, police private persons who come around the school compound to sell. They would only allow you to do that if you are in compliance with the regulations of the school. So there are certain things happening. That is proving to be very successful too. And with the advent of telemedicine and e-medicine, what can happen is that you can minimize those costs because you can get consultations from someone sitting in Canada if you have the systems established where you can be guided. I would want to say at this point we are at the beginning phases of that. We are trying to have our electronic systems put into place, like our medical records, billing and admission system. We're moving to radiology, so it is a work in progress. We have some elements of it, but as I said before, it's a beginning. And we greatly anticipate that happening because we can see ourselves doing quite a lot. Some of it is also happening in imaging, in that we have a private company on island, although we work collaboratively with that company. But most of their images are read in Canada and the United States, so we have some elements of it already in country. And I think what is happening is just a matter of now broadening that base. But as you know, when you're venturing into those areas and you don't necessarily have a lot of the technical skills locally, you rely a lot on international support and support from outside to help to build that capacity. But it is something we are very interested in because we can see the benefits down the road. It allows also for our own people on island to be trained, where you can maybe stay in a conference room and look at a procedure being performed in another country, and our technical staff can learn from that. So it's something we're anxious about also.